I'm a postpartum doula, and before I was a postpartum doula, I was a maternity care nurse trained in the Netherlands, so I had a little bit of background in postpartum work already. When I came to Canada many years ago, I started working as a doula, and I specialized in postpartum services. So I'm a certified postpartum doula, and I'm also a certified infant and child sleep consultant. And to keep up with everything that is new, I often do workshops to make sure that I know all the new changes, regulations regarding sleep, postpartum work, breastfeeding, formula feeding, anything. The main thing of being a postpartum doula, I find, is giving the new parents the confidence to be the best parents that they can be. So if that means that they need me to show them how to take care of the baby, I'll show them that, I'll teach them that, I'll teach them the best and easiest way of doing it. Help them with feeding the baby, formula feeding or breastfeeding. If it means that they need extra sleep, I'll look after the baby if they would like me to, and they can sleep, and whenever the baby needs to eat, they feed the baby. So that's sort of like the main thing that I do as a postpartum doula. Both, actually, daytime and nighttime. If it's nighttime, it's often because parents really want the rest and the sleep, so that I can look after the baby when it doesn't need to be fed and help the baby get the best sleep that it can get. And if I do daytime, it can also be because parents want a break, but daytime is often for parents to get the assistance of how to feed the baby the correct way, especially, or not the correct way, just most efficiently, and how to take care of the baby. So there's often a little bit of a difference between daytime and nighttime. I can only speak for myself. In the doula training, you do learn to understand that, yes, there is some house cleaning, well, not house organizing services that you do, like cleaning up the kitchen, doing some laundry. There's some doulas that might not do it at all. I do it. I do like baby laundry, maybe cleaning, yeah, as I said, cleaning up the kitchen. Just sometimes the dining table is full of stuff. I'll just organize things as much as I can, yes. I actually think that doulas have been around since women gave birth, because the name, the understanding of the word doula is that a mother helps the mother. So it used to be that family members, mothers, aunts, sisters, would help a new mom. So doulas have always been there. I'm not sure how long it has been here in North America. I know for at least 20 years, maybe a little bit longer, when organizations started to train anybody who wanted to become a doula. So at least 20 years, maybe 30 years. I'm not sure how long the official certification body is here. I think it's all about your comfort level, but I think that a doula or a night nurse, if they are trained correctly and they are working within their scope, I think it's really helpful, because if you are having the right person helping you at night, the person will see that and understand that your baby needs to eat and feed at certain times. It's not like your baby will be kept asleep as long as possible. It might really help you if you are breastfeeding to establish good breastfeeding. I guess some care providers might be afraid that another care provider is getting into their lane. They might not be as comfortable with somebody else having the knowledge that they are having also. So maybe insecurity from care providers, or not understanding the role of the other care provider. Like, that might be part of it. If they don't understand, in this case, what a doula actually does, then they might not be comfortable with having that provider being part of the pie. Yeah, I think so. Yes. Oh. So definitely at the beginning when you're starting out, finding the clients in the area that you like to work at. So sometimes you have to travel a lot more than you're comfortable with to get the clients. Then when you do get clients and your name gets out there, sometimes that's another challenge. You get too many clients all at once. So scheduling can be a little bit of a challenge, but what also can be a challenge if you are working with other care providers, that they sometimes have like a plan, certain things that they want the client to do, and you sort of know from your experience that can be a challenge by itself for your client. So your client is following advice from one of their care providers, but you as a doula is already sort of known like this might be really hard to get where they want to go, especially when it is breastfeeding. Because on paper it's sometimes very easy to explain, like, you know what, if you just feed your baby as often as you can, it will all happen. But you cannot always just feed your baby if there are other children involved in the household, if there is a lack of sleep, which is also really important for a postpartum parent. So those are challenges. There's always the advice that parents get, and that overwhelms them, the advice from family, friends, and everybody tells them to do it or a lot of people tell them to do it in a different way than they actually want to go. Then that can be a challenge. So one of the other challenges with what I find is when parents become overtired, exhausted, and still want to be the best parents that they can be. That can be a challenge for them, and we have to guide them through that, and it's sometimes hard to navigate. A lot of parents are a little bit later in age to become parents, like in their 30s, and it's sort of like they've planned it all out. Like, okay, we get married, we buy the house, and then we have a baby, and then they have the baby, and they really have a plan, and then that plan, not everything is going according to plan, and that's when their fear comes in, and it's like, oh, I wanted this to be perfect, I wanted this to be 1, 2, 3 ABC, and it's not really happening like that. So they feel that they are failing, which they are not, and you can just see the fear in their eyes, like it's so different from what I'm used to, like my work life, my life with my partner, everything is changing, and they just fear that they are not doing a good job. That's the biggest fear that I've seen. There's a lot of parents, like, you all think, okay, when my baby is born, this is going to be really good. I'm not even saying perfect, but this is going to be really good. And then they realize, like, hey, this is not as perfect or as good or as easy. So they're not at going to where they thought they were going. So they sort of like now stuck at being, this is okay, but it's not good yet. And that's what they find hard to handle. Sleep, lack of sleep. That's what most parents are very surprised by. And although they do hear, they do read that you're not going to sleep as much, you're not going to sleep as well, and you will never sleep the same after you have a baby, but it still surprises them. That's the biggest surprise. Yeah. It's also like, it's like you're on a treadmill that doesn't stop. Yeah, like you have to keep going. It's also, I think a lot of parents don't understand how something so natural like breastfeeding can be so challenging and so hard to do well and to go well. I think that's another thing that they find very surprising.